Hi everyone, I've been wanting to do this video for ages because it's a problem that I see many times a day in the practice, and I'm pretty sure 99% of the time people who come to me have had a wrong diagnosis. It's a really simple problem. However, outside of chiropractic, people just don't seem to know what this is. Now, what I'm talking about here is a problem a pain that people talk about that is not central in the spine, but usually feels like it's a little bit out to the side, perhaps a couple of centimeters left or right. Sometimes it's reasonably high, mostly it's in the middle back, but it can be as low down as the very low floating ribs as well. Now, the type of symptoms that people talk about when they come in, they're going to talk about pain here. Maybe it's radiating up the neck. As I said, this point pain, it often feels quite hard when you push it. Oddly enough, some of these top points, and I have no explanation for it, will often refer pain down into the arm, and people talk about hand and arm pain. Now, the thing is, you go to the doctor with this type of symptom, they're going to connect it to your neck, which is very logical. There's a neurological connection to that. However, I've seen very often that when I work with these rib problems, the arm pain goes away. I'm still waiting to figure out how that works, but it does. Other things that people complain about, with light breathing, it's often okay, but the deep breath is a problem. Or if they're lying on their side in bed because of body weight, then it pushes on that joint, and it becomes quite painful as well. It can be painful in any kind of movement. It can be painful during rest, and ultimately it can be really quite debilitating. Now, I've had this a lot of times myself, and I've seen it so many thousands of times and had this discussion with my patients, I don't know how many times, that I know that what I do with patient helps in almost, not 100% of the time, but almost. And the reason why it's not 100% is that on a very seldom occasion, there is actually like a disc problem. It's happened twice, I think, in 20 years for me. And the other thing, of course, is if you've had an accident, so if something's actually whacked you, then obviously the ribs themselves can be painful, because if you have anything radiating around the rib cage, then that might be uncomfortable. So what we're talking about here now, so in this plastic model, again, the blue parts of the thoracic spine, and as you're probably aware, we have all these 12 ribs on both sides. And if we're looking now at the side, so the head's sitting up here, and this is the front, so the chest cavity is in here. And you'll see if I put my finger here, then this is kind of like how a rib sits. And so when you have 12 of these on both sides, these little connections here are more like hinges, if you like. They're not real joints like the shoulder or the hip joint might be. And so when you breathe, then these little joints have enough movement in them, that if my arm is a rib now, that you get a nice easy movement. Now, of course, if something happens, and maybe you've just had a sustained bad posture, maybe you've had a sustained activity like gardening for ages, or as I said earlier, perhaps you've just been knocked in some way, and this joint somehow gets twisted or rotated, if you like, just for simple terms. Then we're sitting in a position here now, instead of moving nice and smoothly when you breathe, it's now going to go and of course, if you breathe heavily, that's when you're going to notice it the most. And so in simple terms, the diagnosis is a misalignment with the rib spinal joint. Now, what you'll often have with this is a lot of muscle tension. Now, the reason for that is your brain is not generally going to fire up the muscles in your body just because it's fun. It's going to fire them up to try and fix a problem, especially when it's reasonably acute. So you're going to experience probably a lot of muscle tension. As I said, sometimes it fires up into the neck and your neck feels really stiff. Now, this muscle tension is not the problem, although it itself can be very painful. And so if you do head off to the doctor or to the physio or massage, which makes sense to do so, then they're going to look at that and go, oh, you need to get that worked out, or maybe there's a nerve that's being pushed, or something like the ligaments are somehow stretched, and it's almost always a misalignment with the rib spinal joint. And that's really what we're looking at. So in chiropractic, we recognize that it's a movement quality of the joints that dictates how your body is going to react. And your brain is always going to try and fix things in the first instance, and if it can't do that, it's going to try and restrict the movement so that you have less irritation and hopefully then less pain. Now, there is a problem with these rib joints. As I mentioned already, they're like hinges. And because of that, I'm saying that they're a passive joint. There's no actual muscles controlling the joint itself, like you might say for the shoulder or the elbow or the hand. This means that the way I explain it for my patients, the ribs have 3 levels. Now, the ideal level is when everything's really good, like all the other ribs that you might have, but there's just one that's playing up. Now, when you come to me, you're not on level 1, you're on level 3. And level 3 is it's not moving well and it's symptomatic. What you might find, especially if this problem's been chronic, and chronic means it's more than 3 months old, that it bounces around from level 3 to level 2. And level 2 is mostly not painful, but it is if you push it. And because of this, because you don't notice it most of the time, in this level 2 status, you're probably going to think, oh, it's okay. And what's going to happen, and I've seen this hundreds and hundreds of times, it's going to bounce around between those 2 levels. And so what's really important during chiropractic care to resolve this problem is to get you from level 3, work through level 2, and get it up to level 1. And you might be asking, well, how long is that going to take? Based on my experience with this issue, if you came to me with this rib problem and it's only going to be maybe 1 or 2 weeks old, I would mostly expect within maybe 2, maximum 3 appointments will have that problem resolved for you. I've had people come to me where they've been dealing with this between level 2 and 3, 3, 4, 10 years. One lady had had it all her life. She doesn't know anything else. Now you can imagine that it's been there for a long time. This whole reaction of your brain trying to get the problem fixed or bracing it to try and stop it from being painful has to be worked through. And in this case, it's often very hard to dictate how it's going to work, and it's probably going to bounce around from 2 to 3 quite a bit, and it's probably looking at more of a definitely weeks, more likely months, until that really gets to a nice stable level 1. And if it is a chronic problem, then it's often very, very helpful to get in some stretching, get in some exercises. I can recommend those. Also looking at perhaps some massage or physiotherapy, or using a black roll at home, which can also be very helpful to work through that really tight muscle that's been holding that area stiff for so long. So, like I said, the problem is super, super common. I've had days, 3 new patients, one after the other, with exactly this problem. I will do this explanation, not so long, multiple times a day, quite often. And so this problem needs to be better understood, because most people are getting helpful treatment for it, but it's not getting to the heart and soul of the problem, which, in my opinion, is a misalignment functional issue between the rib and the spine. And if you're not in Lindau or Munich where I am, find a chiropractor in your area and ask the simple question, can you adjust ribs? And if the answer is yes, then you're all on. I hope that's been really helpful. I do encourage you to share this. This video is going to be a godsend for a lot of people who struggle with this problem. Have a great day and hopefully see you soon. Bye-bye.